The following portion of Daytime Tri-Cities is sponsored by Kidsfirst Childrens Urgent Care. Kidsfirst Urgent Care is located on Wesley Street in Johnson City and is open for acute care and for sudden illness and trauma among children. And here to share with us more about this kid-friendly quick care clinic is Dr. Richard McGill. Good morning. How are you, sir?
Good morning. I'm good. How are you?
This is the first urgent care for children in East Tennessee, isn't it?
It's in Upper East Tennessee. Knoxville has several that are sponsored by East Tennessee Children's Hospital. We are not sponsored by a corporation. I own the company and just felt like there was a need to keep people, or especially children, out of the ER and urgent cares that were not comfortable with children.
Why did you decide to go into the field of pediatrics?
Love kids. Absolutely adore them. Everything about them. So I've practiced about 25 years and I like it as much now as I did when I first started.
Now, children's urgent care, you know, we have urgent care centers all across our area. This was specifically for children. How do you foresee kids' urgent care playing out for you?
Usually kids' urgent care is just for those acute, sudden onset things like child woke up throwing up, high fever, sudden pain or trauma like a bike wreck or something. So some place where the parents need to get to quickly. We don't feel like everybody needs to go to the ER for every minor thing. ERs are expensive, probably 10 times the cost of an urgent care. So, but we felt like we needed an urgent care that only employed people that were pediatric specific. So I'm a pediatrician, my nurse practitioner is a pediatric nurse practitioner, and then the people who are working for us have years of experience with kids. So that's what we're trying to do, is just make it very kid specific.
What are some of the specific services that you offer?
We can take care of minor fractures, as long as they don't have to have surgery for those. We can cast and do those. We've actually used for about 10 years a waterproof cast that the kids love, where they don't have to wrap them and stuff to go swimming. So they like that. We do minor lacerations, either gluing, stapling, or suturing. And of course, acute stare like kidney infections, pain, things like that. But we have all the same tests that any urgent care would have, like COVID, flu, rapid strep screens, RSV tests. So if a parent's worried about something very specific, usually we can do a quick test and knock that out. We do not do what I call shotgun medicine, where your kid walks through the door and gets every test that we sell. That's inappropriate. So usually we will assess a kid, and if a parent has a specific fear, we'll take care of that. If they're worried about a fracture or bone injury, then we can do x-rays there. We've also partnered with HMG Outpatient Diagnostics to do more expensive things like MRI, CAT scan, ultrasound. We can't do those at our clinic, but we've partnered with HMG to do them as outpatient. So if we saw somebody with abdominal pain that we thought needed an ultrasound, we could send them up to HMG and they can take care of that.
And you know, anytime you talk about anything on the medical side of things, you talk about pricing and you talk about insurance. Talk to me about your philosophy on pricing and insurance.
Yeah, initially we opened up as a cash pay direct care medical clinic. I'm slowly finding out over the past 2 months that that is not something that is probably feasible. So we are taking insurance. We have started doing the application. That takes about 60 to 90 days to do that. So we will be taking insurance, but we'll still have cash pay options. So if somebody comes in that's underinsured, uninsured, they have high deductibles, they could elect to pay cash and get probably about 25% off our regular prices.
And it seems like the summertime is the need even goes up for urgent care among children because they're out of school, they're doing other things that they normally aren't doing.
Yeah, you don't see a lot of sick kids in the summertime. Somebody with swimmer's ear, conjunctivitis, a rash or something. Right now, in the past 2 months since we've opened, the majority of people that are coming to us are out of state, out of country. Georgia, Alabama, Virginia, Canada. People who just come to the area to visit and they don't know who to go to. So they Google and find the kids' urgent care and they come to us. So.
All right, very good. Dr. Richard McGill, thank you for coming
You're
by
welcome.
today. We're going to give you the information right now. It is all about Kidsfirst Children's Urgent Care. It's located right there, 329 Wesley Street. If you want to find out more information, please call that number you see on your screen. The preceding portion of Daytime Tri-Cities was sponsored by Kidsfirst Children's Urgent Care.